Sonia，我觉得你应该是可以开始了，我把我自己 mute 掉。
Okay. Good afternoon, everyone, and welcome. My name is Sonia, and I'm from Kiwi Kids, and I'll be your host for today's interview. As of yesterday, February 26th, there were 13,606 new community confirmed cases, bringing the total to 71,122. Currently, 263 people are hospitalized, and 5 are in the ICU. The positive rate of nucleic acid test yesterday was 28.38%. The most popular topic of discussion today is the novel coronavirus, and it's starting to get out of hand. We're honored to have Dr. Igor here today. He's a doctor of philosophy on viral immunology. He studies how viruses interact with human immune system. You can ask Dr. Igor questions about issues or concerns, but first of all, let's welcome Dr. Igor to give a brief self-introduction.
大家好啊，我是在奥克兰大学，不对，我想想啊，我是本科是在斯巴卡特大学学的生物 （biomedical science），然后呢，后来又去奥克兰大学学了 master， 学完 master 呢就留下来在那读研究，就要做这个病毒学的研究 ，virology， 或者是如果是American English 的话，那就是 virology 了。virology 主要是研究 rotavirus， 不知道大小朋友知不知道什么是 rotavirus？ 哪个还能知道？有知道的吗？没有啊，轮状病毒啊，轮状病毒就是会很多小朋友都会得了会拉肚子的，但是一般都是在很小的时候，你们可能不记得了，但你们的爸爸妈妈肯定知道你们有没有得过轮状病毒。我们几乎每一个人都会得过，所以但是呢，得完之后呢，就会有immunity，就长大了就都不会再得了。然后我当时研究的这个轮状病毒，它有一个很大的特色，它会制造一种蛋白，然后这种病毒蛋白呢会进入我们的身体里，在我们肠道里呢就会刺激我们拉肚子。大家哪个小朋友可以告诉我，这个病毒为啥要制造这个病毒的蛋白让人拉肚子呢？有小朋友愿意回答吗？
那个不洗手。
不洗手是会让你得这个病毒，对，确实是这样。对，这个病毒它制造这个蛋白让人拉肚子的原因就是为了帮助他们来传播。所以说你说的不洗手，对，就是因为它是通过手口传播嘛，所以病毒就通过让人拉肚子来让传染更多的人，就是这样。好了，那我做了一个简短的介绍啊，就是介绍我之前是干什么的，就是专门研究这些个轮状病毒的。轮状病毒也是一种 RNA virus， 就跟我们现在的这个 SARS， 我们这个 COVID-19 这个造成 COVID-19 这个病毒，它也是一种 RNA 病毒啊。小朋友知道 RNA 是什么东西吗？不知道。那个 DNA 知道的吧？很多小朋友肯定知道 DNA。对吧？那 DNA 跟 RNA 呢都是一种核酸，它们有类似的功能。我们人的话是用 DNA 作为我们的遗传物质，这样的话，我们就把这个 DNA 这个 DNA 就像一本书一样，我们的 cell 就根据这个 DNA 就知道我们需要那个 cell 这个细胞就需要知道什么样的蛋白。那病毒的话，有一些病毒是用 DNA， 有一些病毒是用 RNA。所以呢，他们两个都会用，这就是他们比较特别的地方。好了，现在哪个小朋友还有其他问题吗？有问题吗
？Thank you, Dr. Igor. You can ask him questions about your concerns. If you want to ask a question, please raise your virtual hand. Anyone?
有啊，那个
Larissa?
Hi. I have two questions.
Okay, yeah.
Okay. So my first question is about this morning New Zealand Herald posted an article about how New Zealand has the highest risk value in the world right now for COVID-19. So it's almost at 4, and the other country, the other highest one has only hit an R value of 3, and it's a poor country with everyone living close together and nobody having clean water. But this isn't the case in New Zealand. So what would you say would be the reason for us having the highest risk value in the world?
这个问题其实很简单啊，就是因为我们之前控制的太好了。我们虽然很多人都打了疫苗，但是并不是像之前其他国家已经经过了2轮的 infection， 所以我们的这里还是有很多的人对这个病毒我们叫做naive，非常的naive，所以说病毒在传染我们现在这里的人的速度 R value 就会比较高，就是这个原因。
Okay, thank you.
我其实这个问题我还可以另外一个举一个例子，就是我们香港最近也很严重，因为香港这边控制的也很好，而且香港的死亡人数非常高，已经就非常多了，就是因为之前控制好那些比较 vulnerable 的人呢，他们就躲过去了，但是这一次嘛就不太容易。当然不是说我们当初不应该严格控制，我们应该严格控制，因为之前的 Delta 还有之前的 Alpha、Beta 更厉害，他们造成的死亡率更高。现在的 Omicron 已经是比较 cause less severe disease， 所以说还是之前的策略还是非常正确的，不要大家以为之前的策略是不对的，是这样。
Thank you. So my last question is that, so are there any vitamins that we can eat to protect ourselves from COVID-19?
Vitamin D， 我们全家一直都在吃 Vitamin D。Vitamin D 是我们免疫细胞的一个，怎么说呢，是一种它会帮助我们的免疫细胞或者 T 细胞、B 细胞来给他们更好的，让他们之间能有更好的交流。这个 Vitamin D 是已经证明对免疫系统非常有帮助的，所以 Vitamin D 是你最需要补充的。
Okay, thank you.
Thank you, Sarissa. Courtney? You can ask your question.
So my question is， 就是 COVID-19 嘛，它那个毒性不强，可是毒性蛮强的，可是传染力就不是那么强。可是为什么到 Omicron 毒性就不强，可是传染力就很强呢？
因为这是病毒它的自己的一个进化的方向 evolution 的。因为刚开始出来的时候啊，这个病毒它是从其他动物身上出来的，虽然现在不知道是哪一种动物，但大概知道是那种蝙蝠。现在大概就是我们基本确定是蝙蝠。当一个病毒刚从另一个宿主一个 host， 就是从动物身上突然传播到我们人身上的时候，因为我们的人的免疫系统从来没有见过它，所以就会产生很强的反应。它产生很强的反应，而且也不是很好，不知道如何去很好的控制这个病毒，去 fight against 这个 virus infection。所以说呢，这个很多情况下，这个感染都会很严重，就会有很多人有 severe disease， 然后会死亡。然后在这个病毒每感染一个人，都在我们的身体里不停的复制，都在不停的 mutation 变异，它会不断积累这些 mutation， 然后就产生 variant 之后还能产生 strain。variant strain 的区别，我在病毒现在有一些不同的区别，反正大家只需要知道，就是病毒一直在变化，它不会停止，它只要在传染复制自己，它就会一直变化。在这个变化当中，我们就产生了各种不同的 variant 嘛，现在有 Alpha， 之前 Alpha、Beta、Delta， 然后现在又出现了 Omicron。那这个病毒这个本身的它大多数病毒都是 朝着一个他们的变异，他们不会不是像我们人呢，他不会自己想着我要朝哪个方向去变异，他所有的变异都在以后你们学生物这个 evolution 这个达尔文的进化论的基本概念就是 selection pressure， 那么它 selection pressure 在哪个方面，他们就朝着哪个 selection pressure 那个方面去进化。那他们是病毒，它这个 selection pressure 目前的呢，就是说它主要就是现在就是让它去造成 less severe disease， 但是呢可以传播的更快，因为对于一个病毒来说，杀死宿主不是它的目的，它也因为对它没有任何的 benefit， 它把你宿主杀死了，那它自己也传播不了了，对不对？所以它其实对病毒来讲最有效的就是说它赶紧去传染这个宿主，然后再去传染下一个人，就是这个样。就像我刚才说的，我研究的轮状病毒，它就造成人它就造成人拉肚子之后又赶紧去传染下一波人，它并不是很想把人杀死，所以 rotavirus 也不是会造成很多人死亡，那也是一个比较 mild 的。这个现在的 Omicron 呢，它就是在朝这个大的方向去，不知道这个大家有没有懂呢？
Thank you. Is it okay if you speak English? Because some people can't really like understand.
Okay, yes, I can.
Yeah,
so
sorry.
basically, the reason the Omicron is cause less severe disease is because the selection pressure directs the virus to mutate toward this direction, and basically it's most of the time it's the direction of the virus, so it's kind of common. Yes.
Yeah, thank you. Natalie?
嗯，所以像现在的病毒很厉害，对吧？我们还去学校上学，你觉得这个星期的话呢，我们是不是要在学校上学呢？学校上学好，还是在家里上学好呢？
这个要听你的爸爸妈妈的，这是你爸爸妈妈来决定的。但是呢，我可以告诉你，这个病毒呢，对小孩子来说其实不是很可怕，大多数的小孩子都不会得很严重的病的，所以你不要太担心。特别是如果你已经打了疫苗的话，那就更加不用担心了。病毒的话，只是对老年人会有很严重的疾病。你们的话，其实这个就要看你们爸爸妈妈怎么决定了。我的小孩是在家里的，因为我的小孩，他们的 grandpa 也在我们家，他们的 grandpa 你也是 vulnerable 吗？所以不是我也是怕他们在学校感染之后又去传染了 grandpa， 是因为这个原因，而不是因为我担心自己的小孩会得很严重的疾病。就是你们有很多可能会感染了这个病的话，病毒的话会有嗓子疼啊，会很难受啊，但是一般情况下1天2天就 recover 了，所以不用太担心啊，不要太害怕。
Thank you, Natalie. Karina, you can ask your question.
Why do some people get the COVID? Why do some people get COVID and some people don't?
It's a very good question. It's actually very complicated, and I can give you one example. So because some people already have some kind of antibody present in their body, so some people their immune system knows better to fight this virus. So they got less. Say once they get infected, they will have less severe disease. So this is just one reason, and basically it's depends on your genetic background, your body, your genetic characteristics. So yeah, it's quite common. So for many viruses. I can make an example here. HIV. HIV cannot infect probably several percent of the world population will never get HIV because the HIV, when they infect cells, they need a specific co-receptor. And some people have a mutated receptor. So if they have this kind of gene, then virus cannot infect their cells. So this is just one example.
Thank you.
Thank you, Dr. Igor. Next is Angelica. Sorry if I didn't pronounce that right.
I have two questions. What is the best type of mask?
N95 should work, especially for Omicron. And the normal surgical mask won't help a lot. So if you have an N95, you better use it. But to be sure, you know how to use it correctly, because you have to use it correctly to make the best use of this mask.
What if you use it wrong?
Pardon? Sorry.
What if you use it wrong?
What do you mean? I can't hear you.
What if you use it wrong?
Then you will be infected because if you see any air leakage, the virus still can get in, then you will be infected. And for Omicron, if you stay with someone knows have the virus, then after several minutes, you most likely will be infected. So.
And also, what is the best type of vaccination? Is it the shot or is it the liquid thing, magic?
How do you know there's a liquid thing? How do you know there's a liquid vaccine?
Because I heard one of my ballet teachers was going to used it.
Okay. You know what? My wife was in a clinical trial of a COVID vaccine. That vaccine is a liquid, so you can drink it. Then the vaccine, this type of vaccine is, I think it's working, but it's not proved to be work because clinical trial has not finished yet. If according to some theories, it should work better. So maybe you will have a better vaccine than the current injection type. Either it's drinkable or if it's blow into your nose, something that kind. Because the reason it's better is because, in the immunological terms, it can induce better mucosal immunity. I know mucosal immunity, you won't be able to understand that, but let me put it in a simple word. So basically, this type of vaccine can give you some local protection, better local protection. The virus is infecting your nose, your throat, right? If you can have better immunity around this area, then you got less chance to be infected. Is that making sense?
Okay.
Thank you, Dr. Igor. Next up is.
I have a question about, because we all go to school, even though we're required to wear masks, inside we're still quite close to each other. So, like when we're wearing masks, is it likely to get COVID?
When you wear a mask, it will reduce the chance reduce chance of you getting the COVID. So you better wear the mask again. So you have to wear the mask correctly. So yeah, make sure there's no leakage. One way to test it, if you have a glass, if the glass fog out, means there's some leakage because your breathing is leaking out.
Thank you. Next is Lindsay.
So I have a question. As we know, we have different types of vaccines. So does that mean we have different side effects? Or is it just our
most side effects will be similar because the side effect is caused by our body react to the vaccine. It's immune reaction. The immune reaction, most of the side effects are quite common, like rash or the other stuff. So yeah, so it should be similar.
Thank you.
Yeah. Next, thank you. Next is Lillian.
So, how does Omicron infect really quickly?
Oh, actually, we don't know yet. we observed it. So it's called epidemiological study. So basically, we can see many people, more people be infected very quickly. So that's why we know they infect quickly and more efficient than Delta. But if you ask how this happens, what makes this virus can infect them people so quickly, we don't know yet. So we need more study. So usually this kind of study takes scientists many years to learn.
Okay.
Thank you. If you finished asking, can you lower your hand so I can see like who still needs to ask? Ryan.
Hi. So my question is like about the vaccination. Like, if I got vaccinated, is it like a big of a chance of me getting COVID even though I got vaccinated? Is it still possible?
No, the chance will be very similar. So,
Okay.
but if you get vaccinated, you got less chance to have severe disease. So you have less chance to hospitalize, to go to the hospital. So yeah, and well, it's going to help.
So if I get the vaccine and
yes.
I got Delta or something, I wouldn't need to go to hospital. That
most likely you won't. Yeah.
Okay. Thank you.
Thank you, Dr. Eager. Next is Sean.
I have two questions. My first question is, how do you think of China's response to the outbreak? How would you rate it from 0 to 10?
Probably 11. Too much. I'm just kidding. So I think they are doing good in terms of control the virus, the pandemic. But it's probably too much. But it's difficult. It's political issues. So I can't comment too much on this. But it's not really suitable for New Zealand to use this kind of method. So we are okay now. So yeah, because there's no way to control the virus, and especially Omicron. So one day they will have that. So I don't know how long they can hold on, but hold on the pandemic. So we will see. Yes.
And my second question is, can you provide any estimate of how much of the world is going to get infected? Can you provide any estimate of how much of the world is going to get infected?
I think probably over 80% of world population will be infected. So you can do the math.
Thank you.
So do you know why is this number? So basically the infection will not stop. The pandemic will not stop until most of us are immune to this virus, and it's probably more complicated because many people can be infected multiple times. So it's really a difficult question to answer. But yes, basically, if we want this pandemic to stop, it's probably after 80% of the population being infected, probably higher.
Okay, thank you. Thank you, Dr. Iga. Next is Emily.
What happens if children get COVID?
You will have a sore throat, coughing probably, and fever, headache, sweating. But most of you will this kind of symptom, it will probably just last 1 or 2 days, and then you will get better. And some of you probably will have no symptoms, so you won't even feel it. So it's okay. Yes.
Okay, thank you. Next is Olivia.
How are viruses made?
How virus is made? It's always there. So this virus is evolved from another old virus. So it's not made. It's always there. It's earlier than us. It's probably the early life form than us. So that's why they have RNA using their genome, because we are later. Our humans, we are later. We starting using DNA as our gene, and these RNA virus, they existed since very long time ago, billions years ago. Yes.
Okay, thank you, Dr. Go. Next is Lisa.
Because 12 years and above gets the same amount of vaccine as adults, then why does it have to be 18 plus to get the booster?
18. Oh, yeah. Okay, so it's not there is not a clear cut there. So it's all depends on those the medical and scientists to decide when you guys can have a booster. I think in other countries they already receive booster. I'm not sure, but yeah, to me it's not a problem to receive a booster for you guys. The question is whether it's necessary, and we need to think about the risk and the benefit for young kids to receive the booster, because as I said before, so most of you will be okay. You won't have the severe symptoms, and but vaccine can cause side effects. Some may be severe. So this is the risk. So we need to balance whether the benefit is much higher than the risk. So if the benefit is not too high, so why we want to give you the boosters? So that's why.
Okay, thank you. Oh, also another question.
Yeah.
Because 5 years old to 11 years old will be receiving the same amount of vaccine, right? So does that really work? Because 5 to 11 is a really big age gap.
Yes. And I think it's actually based on the development stage of the immune system of young kids, So it's not based on weight actually. So also the company, the Pfizer, when they designed the clinical trial, because you have to pass clinical trial to get approved for use. The protocol they use is using this dose. So that's why they have to stick to the protocol. So it's not that kind of a special reason for them to choose that amount of that vaccine. So yeah.
Thank you.
Okay, thank you. Is there anyone else that hasn't asked that wants to ask something? Hanson, Mason, Benny, like anyone?
No more questions?
Yeah. I got 2 questions. So the first one is, now there are some people who will not get sick from the vaccine, but there are also a vast number of people who will get sick from this. So I want to ask, have you ever developed a vaccine that will not make people sick?
Sorry, I can't get what you mean. Sorry, can you say it again?
Maybe I just used that word.
So you mean, are you saying many people get sick because of the vaccine?
就是有很多人不会因为这个疫苗而生病，但是也有大量的人会因为这个而生病。所以我想问一下，那个你们有没有研制出那种不会让人生病的疫苗？
没有，每一个我说的So let me rephrase it. So it's not vaccine that cause disease. Vaccine cause side effects. So every vaccine cause side effects. So sometimes it's very mild, you may not notice it, and some may cause severe. With the reason this vaccine sometimes cause severe reactions is because depends on the person. Some persons immune react to the vaccine very strongly, but some just reacted to very mildly. So that's the difference. But there's not one vaccine that is completely safe. There's not one vaccine that is completely safe. So yes.
Okay. So I just asked my second question.
Yes.
So I would like to ask how far the vaccine against this virus has progressed. So, for example, the first few shots of this vaccine can make it immunity to the virus with a high probability.
What? I can't speak Chinese.
就是说，这个病毒的疫苗，那个就是进展到哪一步，然后还有打几针这个疫苗，可以大几率的让自身免疫病毒。
Okay. So I think most people do not understand what vaccine do here. So the vaccine cannot and do not prevent infection. It's basically what it's doing is prevent severe disease. Severe disease is, well, if one vaccine can prevent infection, then that's great. But not many vaccines can do this, and especially for this type of virus, which is a causing respiratory disease. So not one vaccine can completely prevent infection. Previously, we don't even think we can make a vaccine for coronavirus. It never works. And the vaccine, the antibody cannot last very long, mostly several months, and then it's gone. So still, even for the mRNA vaccine, the Pfizer one or Moderna one, the reason we are getting a lot booster is because the antibody dropping quickly. But antibody dropping quickly doesn't mean you lost protection. Your body, your B cells, T cells of the immune system still can protect you from severe disease, hospitalization, dying, something like that, and also long COVID. So yes.
Okay, thank you.
Thank you, Dr. Gu. There are still like a few people who haven't asked. Dora, Brayden, Vivian, Isabella, Chloe, Ray, and Mason. Do you guys want to like ask something?
Does vaccines help people get better?
I don't know. I'm not sure I can say yes here because you probably recover quite quickly, but it will not help you. Will reduce the chance for you to be infected. So, but it will help you not getting severe disease. not having long COVID, something like that. So that's great, right? You don't want long COVID. You don't want to live in hospital, and you don't want short of breath that you can't feel, you can't breathe. That's something we want to prevent. Yes. So when you, let me make an example here. When one of your family member get infected, the first thing is you may think, oh, well, what happened to me? Am I going to get infected? Am I going to have a very severe disease? So if you are vaccinated, you most likely will feel, okay, maybe I should be fine. Getting better fine. So yes, one of my friends, their kid just was positive 3 days ago, and he got some fever. I think his son is around 6 or 7, something like that. Yeah, and he got fever to 38.9, and it's just 1 day, 1 night, and next day he's completely fine. So so that's what, maybe I guess that's because he had vaccines.
Okay, thank you, Dr. Ge. There's Braden. You can ask your question.
Which country had COVID first?
China.
What?
China, Wuhan.
Okay.
Yes.
All right, thank you. Is there anyone else that hasn't asked that wants to ask? Natalie, you want to ask something else?
我先在那个 chat 里面有一个人 ask a question 啊，维生素 C 也是可以吃的，但是1岁半的小宝宝这个就我不建议服用太多的维生素啊，因为这个年龄太小了，你这个剂量不好掌握，特别是维生素 C 是比较 safe， 虽然比较 safe， 但是维生素 D， 特别是维生素 D 是不能够吃过量的，所以小宝宝1岁半建议不要这样，主要还是成年人打了疫苗之后，你的母乳里面是有抗体。Okay, let's continue.
Okay, thank you. Next, Corbin, can you ask a question?
What is the strongest effect that will have on you if you had the vaccine?
The strongest one, the worst one is probably myositis. That's the inflammation of your heart. That's going to be a big problem.
Okay, thank you.
Yeah, but for kids, it should be okay because you guys have great recovery ability. Your heart muscle can recover quickly. You have stem cells there, heart stem cells. We our adults, we won't have that anymore. So lucky you.
Okay, thank you, Dr. Gu. Vivian, would you like to ask a question?
No, thanks.
Oh, it's fine. Natalie, would you like to ask something?
Sure. Mm. 所以像有一些人去打预防针，后来，他们为什么会得病呢？
So just as I said before, the vaccine cannot prevent infection. And if you want some details, it's because the virus still can infect you. They can, just like an army attacking a country, they still be able to first land it on first getting a foothold in that country, but they can't invade further. So well, if you get vaccine, then most likely the virus cannot get into your lung, cannot get into your other organs, but they can still infect the area around your nose, your throat. The reason behind this is because the immune cells and the antibody level are lower around this area. So that's why the virus can still, and also the Omicron is especially adapted to replicate around this area. So that's why it's even you have the vaccine, you still going to have you will be infected, most likely. Yeah.
Okay. Okay, thank you. Next, Chloe, would you like to ask something?
No thanks.
Okay. Ray, would you like to ask something?
Many people say chlorine, like you're safe from COVID in the pool because of the chlorine. Is it really true?
What? Chlorine?
Many people say that you're safe from COVID in the pool because there's chlorine in it. Is it really true that chlorine like kills COVID?
Well, yeah, chlorine can kill any virus and can kill you actually. So if when the concentration is high, it can kill anything. It's disinfectant. But I don't think it's present in your pool. No, it's not going to be present in your pool. Oh, you mean the pool, swimming pool, right? Yes. Okay. Yes. I think yes. Your pool will be safe. So I think the concentration of the chlorine in the swimming pool is high enough to kill the virus. So, but the problem is the virus still present in the air. When you have your head above the water, you're still going to get virus into your nose and get infected.
Thank you.
Yeah.
Okay, thank you, Dr. Gu. Next, Mason, would you like to ask something? Bianca, would you like to ask anything? Okay, Andrew, do you wanna ask Dr.
Okay.
Gu?
Okay. Like, how long does it take for hand sanitizer to kill corona?
Probably several minutes. So how it works is the ethanol just dry up, and then the virus contains the amyloid, and when it's dry, it just lost the function. So usually it's a quick. It's a quick. If your hand dried after sanitizer, after using sanitizer, then means the virus has been killed. So, but you need to have the right amount of the alcohol inside, at least 70%, ideally 75%, something like that. Yes.
Okay, Karina, do you wanna ask another?
Yes. Why do people get symptoms for COVID and why do some people don't?
Yes, depends on what kind of symptom. Some symptom is caused by the virus replicate inside your cells, especially your respiratory cells, the cells covering your nose, covering your throat. If they replicate a lot there, and there are some cell deaths and inflammations, and then you got sore throat. But some may caused by your body reacting to the virus. So they detect danger signals, and your immune cell produce just deliberately to to induce fever, to help the body fight against the infection. So that's why. So if someone reacts less to the virus infection, then they won't have fever, they got less symptoms. And yeah, that's the reason, basically. Some people just have less symptoms. Well, it's okay for this virus if they don't invade further. So even your body not fighting back hardly, and it's okay. You are still be safe. So
Thank you.
Okay, thank you. Ryan, do you want to ask something?
Why do we need to eat vitamin D?
yeah, as I said before, so vitamin D help your immune cells to work better. So it's like a nutrient for them. You can understand this. Or booster, like a V for the immune cells. Like well, you can't drink V, but probably you can think about like a coffee for the cells, immune cells. No, I'm just kidding. I'm just giving an example, helping you guys to understand it.
Thank you.
Okay. Thank you. Bianca, do you want to ask something?
要是以后得了 COVID-19 会怎么样？
对未来对将来有什么影响？
Yeah, have you got a vaccine? Have you got your first dose? Okay, so let me answer your question this way. So if you get infection later, your antibody probably at that time is a bit low. Your symptom, if you have symptoms, probably a bit stronger, but most of the time you will be fine, as I said before. So that's why after vaccination, after 3 weeks, it's probably the best time to be infected. but we still don't want to be infected. So yes, the antibody levels will drop, and the protection will drop probably around 4 months. This is why at the first we got booster, but for the kids, yeah, you guys should be fine. And yes, and what was your question before? Yeah, so I'm not sure I'm answering your question in the right way.
我说的是，要是得了 COVID-19，
对将来有什么影响吗？
对将来有什么影响？
Okay, so I know what to answer now. So most of time, you only got long COVID. If you are referring to long COVID, that's the long-term effect when you have the infection. But it only happens when you have, most of the time, it only happens when you have a severe infection. You get hospitalized, you need medical attention. And that's because the virus replicates inside your body a lot, damaged some of your organs. Do you know what the organ is? Yes. If the virus replicates in your body a lot, causing damages, then maybe you will have long COVID. But if the virus is only replicated locally, I mean that your nose, your throat, it's not going to cause long COVID. The only thing I'm a bit worried is probably the loss of taste. It's probably because it's still quite local. Your tongue, right, is still local. So if some people recover from that, probably very long time. So that's unfortunate. But as a severe complication, I don't think it's going to be, unless yes, you have severe disease.
Okay, thank you, Dr. Gu. Courtney, do you want to ask another question?
So my question is，洗手好还是那个 hand sanitize 好
？Better to use both. If you don't have the soap there, then you just use the hand sanitizer. I would prefer to use soap. You wash your hands several minutes, not just the 10 seconds, okay? my kids just wash 10 seconds. That's not going to work. So wash your hands thoroughly with soap. Soap will also kill the virus. So yes.
Thank you.
Okay, thank you. Guys, we have 10 more minutes, but next is Angelica.
How many cases can you get a day for Omicron?
How many cases? Today we have nearly 15,000 today. So that's the number that we detected. So the real number you will never know because we can't detect all of them. So based on the that's why there are some scientists are using computer modeling to predict the number. According to them, we probably if we detect 15,000, we probably got 50 so per day. So that's the number. And probably within a month, at over 60% of Aucklander will be infected. Yeah, something like that.
My second question is, can doctors get coronavirus?
Yes, many of them get that because they be in contact with those patients. And even they have been very careful, still virus is very infectious. They are tiny, you can't see them. So if you are not very careful, then you will be infected. Even doctors will the same.
Okay. Oh, sorry.
You a doctor?
I'm a research doctor, not a medical doctor.
Oh.
Okay, thank you. Next is Corbin.
Like you said, there are a lot of cases today, right?
Yes.
When do you think the amount of cases would start lowering down again?
Probably within 2 or 3 weeks. And it within 2 to 3 weeks, it will reach the peak and then slowly declining. It probably takes a month or 6 weeks to get back to 1,000 cases a day, something like that.
Okay, thank you.
All right.
Okay, thank you, Dr. Gu. Does anyone else have any more questions? No. All right. Now may we please have our teacher, Jessie Wu.
Sure, thank you, Sonia. Sonia, do you have any questions?
No, like everyone already asked the question.
Wonderful, thank you. 要谢谢葛博士。葛博士，我刚刚有收到一大堆家长的问题，孩子们有 a little bit different。Okay, so 第一个问题是他们想知道的是the current situation of a hospital， 现在医院的一个现状是什么样子？
现在医院其实还好啊。因为我是在不同的医院的情况不一样。我是在 City Hospital 嘛 ，City Hospital 其实还是可以的，但是不同的部门就忙的程度就不一样。现在 Emergency 还有一些，包括我们这个 Cancer Department 那个 Day Stay， 就是非常忙，而且每天都有 detect 到 case， 那就是护士就是非常的，主要是护士都是 work under stress 啊。那医生大多都已经 work from home， 也不是 work from home， 他们还在医院里面，但他们不是面见病人啊，都是 telehealth， 都是通过打电话来做 assessment。 这有些当然有些那些重要有需要的还是会被要求来医院去来做检查的。就是说，就是现在医院的策略上尽量就是把一些不是很重要的都会被delay掉，主要是照顾那些有急需的人，就是这样。但是就是说，对于医疗系统来说，真的是压力还是挺大的，因为特别是护士，你在一直工作的如此强度下，你不知道他们能坚持多久。
谢谢葛博士。然后，因为现在很多的一些博主啊，还有一些药房都在推荐现在的常用药，包括刚才你提到的维生素 D， 包括还有我看到发一些我们 pharmacy 里面可以见到的一些药，和包括像制氧机、血氧仪等等，这些是不是我们真都是要去囤一下呢？
血氧仪可以，那个你可以，如果低于90%，那你肯定是要赶紧去医院了。那个制氧机是什么东西？我们有制氧机吗？
有，就是他家里面常用的。我看最近有很多一些就博主啊，然后还有一些在推荐的。对，所以我们作为 parents 来说，就其实还挺想知道家里面是不是需要它就是就像家里面用的这个氧气机，供给氧气的这个机器，我们需要备这样的东西吗？在新西兰，你觉得？
我没有见过有这种可以在制造氧气的，因为氧气浓度很高，那不是很好的事情啊，因为氧气会造成身体 damage。一般如果你就算如果是真的是因为很缺氧，你靠制氧机也是没啥用的。家用的我估计制氧机也肯定就是它制造出来氧气应该是很低的吧，所以有没有效果我也不知道。真正的需要囤那肯定是 Panadol 了，那更要被需要你得囤够。然后其他的话是你基本上就是硬扛啊。如果被感染了就是硬扛睡觉，好好休息，多喝水。晚上基本上都会挺难熬的。因为我也看到过很多朋友得过的朋友，那就是一直发烧盗汗，很难受的。有人说可以喝这个什么莲花温情胶囊。我自己并不是很中医，不算中医粉吧，因为我学的是西医，但是我朋友说有用，那多吃了也无妨，对吧？你就可以囤一下，对。
好的，好，那要谢谢葛博士今天在好不容易周末休息，还来给我们 QB Kids 的小记者来解答。现在我想请我们所有的 QB 的小朋友们，今天参加这个我们的 Meeting with Dr. 葛的小朋友们 turn on your video， 然后让葛博士看到所有的小朋友们，然后让我们一起来谢谢葛博士，也要祝葛博士在医院里面多多保重，然后要祝我们的小朋友们、小朋友的爸爸妈妈们、老师们都能够健健康康，然后 take care。谢谢
大家要小心哦，注意好自己，注意好自己身体。
葛博士 ，Thank you， 好不好 ？Thank you，
谢谢，不用谢。
谢谢，拜拜，
谢谢，
拜拜，
拜拜，谢谢，拜拜，
拜拜，
See you on Tuesday. Bye.
See you on Tuesday. Bye bye.
Bye.